Hey everyone, welcome to another episode of Scrubs and Software, and we're keeping with the emergency medicine theme. This week I'm going to be checking out Choreo. They are an emergency medicine focused application of AI. I ran into them at TSAP earlier this year, and I've had a chance to chat with their team a few times, and I think what they're doing is really, really cool. So just in case you're not familiar with the emergency medicine workflow, what happens is, a patient comes in, I'll see them. Usually most emergency medicine physicians, obviously if you're practicing, you'll have a good idea if someone's going home or they're going to be admitted right when you walk out of that room. Now, to relay that information to the rest of the hospital, right, the bedding folks, the maybe EMS folks if a patient's getting transferred, the ICU nurses, the charge nurse, all of that takes time. And so even though I may know a patient is getting admitted, what happens is I need to obviously get the workup and get the diagnoses and consult the appropriate services. And then I reach out to the hospitalist and they accept that admission, and eventually the admit order goes in. And it's a very kind of stepwise process that takes a lot of time. Now, for a hospital system, it would be valuable if they knew immediately or as quickly as possible that someone was going to be admitted or discharged, because then they could plan for that, right? Maybe a certain hospital doesn't have enough beds, and then they can look at their sister hospital, or maybe they can kind of anticipate, hey, we're going to be getting like 5 admissions from the ER. Let's see if we can downgrade some patients from inpatient status to OBS, or from the ICU downwards. And so this is where this becomes useful. And they like to say is what their tool does is it transforms frontline clinical intuition of patient disposition into an objective system-wide signal. And so they're not trying to replace emergency medicine physicians. They're not trying to say, hey, we can predict better than the ER physicians. What they're trying to do is replicate what an ER physician like myself would see and relay that to the rest of the system. And so they have this tool, and this is the back end of it. So this isn't what a physician or anyone would really be seeing. I imagine you could probably dig into this if you wanted to, if this was something that was available at your hospital, but this is them demonstrating the back end. So in this example, they basically have a 75-year-old female who came in through private transport for altered mental status with chronic pulmonary disease. Now, I'm immediately able to tell you that patient is getting admitted almost every single time. And so this is them kind of demoing through all of that. You can see that it's showing that this patient has numerous previous ER visits. That's obviously going to kind of clue into like, hey, maybe this patient is sick frequently. They maybe are getting admitted frequently. This up here basically shows the decision to admit, anticipated decision to admit. So it's already at like an 85%. And it's cluing that in based off obviously how the patient got there, what their chief complaint is, what their vital signs are here, what the tests ordered are. And so obviously if I'm ordering a single x-ray for an ankle sprain, that's less predictive of an admission versus something like this. It's showing that the heart rate's 125, the white blood cell count just came back and it was elevated. And so those are all clues that this patient is likely going to get admitted, and you can see this number rises with each one of those steps. Now, in speaking with them, they had said that each hospital can set their own threshold, right? So you don't want to get this wrong. And so a hospital might say, hey, the anticipated decision to admit threshold might be like 80% for one hospital versus like 85% for another. So that's something that can be adjusted. And so this is showing that there was this difference of a lead time of 134 minutes using Choreo versus when the ER physician actually put that order in. And so how this shows up is they can work with basically various EMRs, so Meditech, Epic, a whole bunch of others, and it's basically like a little indicator or a flag or whatever that hospital and EMR system wants it to be that kind of clues in whoever needs to know, whether it's the bedding folks or the transport folks or the hospitalists or ICU physicians, that, hey, this is the decision that's going to be happening. So the kind of main things that they look at are patient history, lab results, imaging orders, medications given, vital signs, and triage information. And it essentially is, like I mentioned, replicating that feeling of that gut feeling that I and every other emergency medicine physician gets when you walk out of that room. And so I think this is useful. Now, kind of the flip side of this is if you're in a hospital and there's no inpatient beds, then this isn't going to be helpful, right? You could tell every hospital administrator, every person involved in the process that, hey, this patient's going to be admitted, but if there's no beds, that patient's not going anywhere. Where I see this being really cool potentially is if, you know, I have no beds at my hospital, but then maybe this tool gets further features or it gets integrated with something else where it says, hey, the sister hospital 5 miles away does actually have that type of bed and the service the patient needs, and it maybe alerts, you know, the OA or the charge nurse at that hospital. Maybe it alerts a transfer center individual. Maybe it alerts the accepting hospitalist at that hospital. And that could really be a game changer in terms of helping with flow through these large hospital systems. And that right now is sometimes not a pleasant process, right? You sometimes have to make a lot of calls. You have to call transfer centers. You have to get the clerk involved. There's a lot of back and forth calling between the hospitalist you're sending that patient to, other consulting services. And so maybe this streamlining some of that would be really, really cool. But I think this is definitely a tool that has some benefits. I haven't really seen anything like it out there at the moment. I think they launched fairly recently in the last year, a little over a year or so. And I think as more and more hospital systems and ER groups kind of hear about this, there's going to be a lot of interest over it. And so really exciting to see another AI tool that's actually being used to, you know, help the logjam of patients that we have, helping burnout in a way as well. Hopefully, you know, patients getting bedded quicker and less boarding in the emergency department is helpful for all of us. And another tool that, you know, selfishly is an emergency medicine tool. And so I always love AI being applied in the emergency department to make things better. So really, really cool tool. Obviously, if you're watching this and you have a tool or app or AI application you want me to check out and give my thoughts on, let me know. Thanks for watching.